Hey, what's going on, everyone? This is Dr. Ryan Baum, sports physical therapist with Endvr Health. I am glad to be back doing a different format this time. Doing a quick podcast / video. If you check it out on our YouTube channel, hope you enjoy it. Let me know in the comments what you guys think. Hey, what's going on, everyone? This is Dr. Ryan Baum, sports physical therapist with Endvr Health. I am recording on a Sunday. Not any Sunday, Super Bowl Sunday right now, just because, it's quieter here at Elite Edge Fitness where I'm proud to be located still here. And I'm just glad to be back. I know I released a few videos a few months ago, but I just wanted to let you know that professionally and personally, things have been a little difficult for me lately, but I'm slowly recovering and actually just super excited to be back and bringing more health-related content to you guys. And it's interesting. A lot of my friends even say, like, where's the next video coming from? Or when are you going to do the next podcast? Or where are you doing your next vlog? And, well, here it is. Just doing a little different format, doing some things differently and see how I could really still reach out my message of health and exercise and lifestyle management and things like that. So this is something I wanted to definitely do, and thank you for joining me, and thank you for your listening and your attention. So today on this, first episode of 2019, I wanted to talk about load versus capacity. Now you're probably wondering, Dr. Baums, what the hell does that even mean? Really, it can mean a lot of things, but for those that are physically active, that's in your lifestyle right now in terms of you are exercising 2 to 3 times a week, or you're playing a recreational sport, or for all the weekend warriors out there, load and capacity is what I think is the most key element to living a healthy life. Let me break it down to you this way. Load is anything that you have to do for your sport or over a volume of time. So for example, if let's say I played out tennis, singles match, and I haven't played tennis before, that load for me will be pretty high because I haven't really trained for it. But let's just think of it as load as maybe an activity that you love doing, whether it be one time or over a series of weeks, days, months, and even years. Runners, I know I treat a lot of you guys and girls in terms of with the runners that I see, load can be anything as mileage during the week, or it could be the type of race that you run. 10K, marathon, or you're running 10 miles a week, or for those hyper runners, you're running 40, 50, 60 miles a week. That is load. Now, capacity is your body's ability to meet that load. So for someone that runs a lot, they have a huge capacity built into their muscles and to their heart, circulatory system, and whatnot. So they have that capacity. They have that ample room to take whatever load comes their way. So for someone that runs a lot, let's say runs marathons on a consistent basis, they have plenty of capacity to run that 5K. But for someone that maybe doesn't work out or doesn't run on a regular basis, when they run that 5K, that's going to be near or maybe oftentimes exceed their capacity to run that 5K. And I hope that makes sense. And again, if you have any questions or if any of this does not make sense whatsoever, just leave a comment below down there on the blog and the podcast, anything like that. Hit me up on Instagram or Twitter. I'd be happy to answer any questions and clarify anything that doesn't make sense. So again, capacity is your body's ability to meet a certain load. Let's take it for a kind of a more real-life example. With pro athletes, load and capacity is constantly monitored and managed by a 24-hour, 24/7 professional staff. And if you're thinking for those that are like me and you're thinking, well, I'm not a pro athlete, I just do things for fun and I want to just make sure I stay healthy, then you're going to have to pretty much manage load and capacity on your own. And if you need any more further guidance, you can really consult with someone like me, a sports physical therapist, a really good, highly trained strength and conditioning coach, someone that can help assist in terms of figuring out between load and capacity. So let's bring it back to the pro athlete, right? LeBron James, one of the best players of all time. I'm not going to argue that right now on this podcast. But LeBron James recently was out in, I think, mid to late December with a groin injury. Now, a groin injury can mean many things. As with most news outlets, they're not going to get to the nitty gritty. I wish they would. I wish they would say it was this muscle or this ligament, but that's for just the medical physical therapy nerd in me. So he had a groin injury that he suffered in the game, and he was out for weeks for it. And as a physical therapist, I knew and that may happen. Groin injuries, there's nothing special about it, but just any muscle strain is going to take weeks to recover. Well, recently he came back. Let me just pull this up here. He came back and to a game after a few weeks out, and he was sore after his return. And does that make sense? Absolutely. There's no way, even in practice, can they replicate the game speed and intensity of an NBA regular season game. You just can't do it in practice. And honestly, you wouldn't even want to, because you don't want to put that same intensity and game speed and game force in practice, because you may hurt your players, and which is the last thing you want to do if you're managing a team. So LeBron James came back. He posted 24 points, 14 rebounds, 9 assists in 40 minutes. And he was sore. And does that make sense? Absolutely. You played 40 minutes after being weeks out from game intensity of an NBA game. For him to feel sore makes no surprise to me. And some of the reports say that they're essentially managing him in terms of load management. So it's so interesting, the timing in terms of what I wanted to talk about today and what was in the news in terms of load management. What they're doing with LeBron James is managing those tissues and making sure that the load placed on his body does not exceed his capacity. So let's break it down in another way. His groin muscles right now are recovering. We know that happens for a fact day in and day out. He has trainers and medical staff that's assisting with that. And to know that he was sore after that NBA game, regular season game, gives them a data point and kind of info as to how those tissues responded. It's never really quite an exact science. We can't say, oh, you push this leg press 200 pounds, you're ready to go. Unfortunately, rehab gets a little gray at times, and so you really won't know until you just go out there. Obviously, there were some certain criteria for him to return, likely pain-free with walking, pain-free with running, pain-free with doing cuts, drills, things like that. But once he got to the game, then his staff really got to know how he was responding. So if he felt sore from medical staff, and if I was on that staff, I'd say, you know what? Let's see and give him more time to rest, more time to recover. Because what you don't want to do if you're in that management situation from a medical staff or even a team staff, you don't want to put him out there in the game where the load of an NBA game exceeds his capacity. Because you know what that means from a muscle standpoint, ligament standpoint, or tendon standpoint? If your load exceeds that capacity, well, guess what? Injury will happen. An injury could take form in a lot of ways, such as a muscle strain, maybe even worse, a muscle tear, like a complete tear or a tendon tear. And that's just something you don't want to do with your star player, your once-in-a-lifetime player in LeBron James. And, there's many elements to management when it comes to an injury. You're looking at outlook of a season. Last I checked, the Lakers are not in playoff rankings right now, 1 to 8, so they're on the outside looking in. So you have to consider, are we making this playoff push? Do we need LeBron James? Can we win without him? Can we afford for him to rest? Progress of the tissue. He's feeling sore now. How is he doing in his workouts? How is he doing during his treatment sessions? It's variable per person, but that's some of the elements related to the management. So, when I assess athletes, I'm always constantly thinking already load and capacity. Anytime an injury comes my way here in the clinic, I'm thinking, okay, well, what was the mechanism of injury? And then I also then start asking questions leading backwards before the injury even happened. What has that athlete or my client in front of me done to prepare themselves for that load? Have they built enough capacity to do what they want to do? And oftentimes for us recreational athletes, our weekend warriors out there, we're probably not doing enough to build that capacity, meaning we're not in that weight room, we're not in the training room doing enough to make sure that our body can do whatever it needs to do at any moment, at any time. So I'm thinking preparation. And so to quote one of my favorite NFL players, and I was there during his rookie season, I was there in Seattle witnessing that, and Russell Wilson, the separation is in the preparation. And for those who are thinking, I'm only doing this for fun, I totally agree. If you're doing it for fun, that's great. But if you want to feel good doing it, you're going to want to put in extra time in the weight room, in the training room to prepare your body to do whatever you want to do. So for me personally, I'm not participating in any sport. I'm not competing in anything, but I do want to stay healthy. So right now, am I in a maintenance phase? Yes, I'm just maintaining my strength, but I do have some goals in mind. So for the year 2019, I really want to push my 1 rep max for my deadlift and my squat. And from a longer term view, I'm lifting for 80-year-old Dr. Ryan Balmes. So what that means is I'm just wanting to maintain and keep working on my body so that it's strong, not only for summer 2019. I'm not out here trying to be posing for any of the magazines, but I'm out here strength training and doing the best I can for 80-year-old me to be as strong as possible. And we all know that regular exercise on a regular basis, incorporated with a healthy diet and a healthy lifestyle, healthy managements of stress, can really go a long way in terms of your overall health. So that's what I'm doing. I think, actually, I lied. So I'm actually scheduled to run the Gate River Run. Not sure if I got that name correctly, but in Jacksonville with my brother there. So knowing that's going to happen in March, I don't have much time right now. I only have about a month before that race, so I need to start building up on my capacity to make that race. I think that race is a 10K, or maybe it's a 15K. Let me take a look. Gate River Run is a 15K, and let me just translate that to miles. 15K is 9 miles. So the last long run that I've done was 5 miles. So as you can see, my capacity to even make those 9 miles is in question right now. So I have a lot of work to do to get to that capacity. Excuse me. And I have no doubt that I will finish, but knowing the competitive self in me, I want to make sure I get a decent time for that 15 kilometers. So that's a clear example of when you are planning in the future for either an event or a goal, then you start working backwards in terms of what can you do to build capacity so that load, that event is not only possible, but it isn't high in terms of the amount of load that you can take. So if I could, let's say the 15K is about 9.3 miles, if I could put in confidently and comfortably maybe even more than that, I know that I have some room to grow, room there in terms of with my capacity and load. So I mean, let's see. Let's talk about some of the other notes I have here. So let's talk about in terms of the capacity timeline. So for those of you listening or watching out there, when you're trying to build capacity, what does that mean in terms of a timeline sake? And this is for anyone that's not currently injured. Which means that you're not experiencing any pain. Weeks 2 to 4, so 2 to 4 weeks, you are building capacity in the sense of your motor learning, meaning you are priming your brain to understand what it means to activate muscle, activate movement patterns, not only in the right way, but in the most efficient way possible. So the brain is already learning and setting down neural pathways in your brain to do the jumps, to do the squats, to do the running. And we forget that we think that muscle is muscle. Like, I do a bicep curl, it's happening at the muscle, but we forget that it's your brain, it's your nervous system, it's the spinal cord, the nerves there that transmits your intention to move into actual movement. So if you're exercising for the first time or you're getting back to exercise, the first few weeks, 2 to 4 weeks, you are setting down improved and efficient neural pathways to move better. Now, in terms of actual muscle changes, so a lot of people are concerned of either increased strength or increased muscle size, that's going to start happening around week 6 to 8. So 6 to 8 weeks, you're looking at hypertrophy, aka increased muscle size to your body. And we all know that the bigger the muscles are, the greater the force that they can produce, aka you're building more capacity. So for me, I'm really focused on a lot of just deadlifts and squats. I don't quite remember my last deadlift. I'm sure it was in like the 220 range. That's probably my 1 rep max, meaning that if I could do that as my 1 rep max, that is my capacity, if you will. So anything less than that, I'm able to handle that as a load, jumping with just my body weight, maybe doing lighter squats, doing lighter leg presses, things like that. And it brings me back to another point. Let's say you're not having a sport at all. I want you out there listening and watching here that the load and capacity matters in terms of your daily life. Think about how much you weigh, and then think about going upstairs frequently, or think about carrying your bag or groceries or your baby or your dog, things like that. Things that require your muscles to activate and turn on and contract and produce that force. Do you have the capacity to do that day in, day out without feeling tired? And if you are starting to feel tired during the day, or you're starting to notice even like the most simplest things are starting to get difficult, this is what's happening. Your capacity is declining, yet the load still remains the same. Meaning, let's say, and I've seen this in some of the clients when I used to work more at like a workers' compensation type clinic, where you work a pretty strenuous or physical job, and if you're not doing any exercising to maintain your strength or build upon your capacity, that load that's required of you, let's say lifting boxes every day, is not going to change. But yet your capacity to do so is declining because you're not doing anything to help your body, to help maintain it, to help grow it. Then in the end, you're really setting yourself up for an injury, because as your capacity declines, but the load stays constant, something's going to give. It's going to get to the point where that load exceeds that capacity, and then you're going to have an injury. If we look at it from a longer viewpoint in terms of like the lifespan, I'm 32 years old. If I were to do no exercises from here on out, the one thing that we do know is constant, unless, something weird happens here on Earth, the one thing we know that is constant here on Earth is gravity. Gravity is unchanging. It's a load that we have to manage with every day when we stand up, when we get up out of bed, when we walk, when we run, when we stand. And babies, when they're born here on Earth, they're trying to figure it out, and they get it. The gravity is unrelenting, and that is a load that we always have to manage. So even from the simplest standpoint, if you could maintain that capacity to even just stand here on Earth, that is a worthwhile goal to be doing. And I think that's why I mentioned, that's why I'm working out for 80-year-old me. I've worked in clinics when I'm dealing with more geriatric populations, and when you ask them if they regularly exercise, they don't. They are not strong enough to hold their body up to gravity. They are living in constant fear of potentially falling and breaking bones. And I know for me, I know for a fact that could be preventable. And so for those of you that are listening out there that are in your 30s or 40s and you think that's too far out, it's never too late to build that capacity and maintain it and keep it going. Because I could tell you this, when you're at that age and you're trying to build strength, it's not impossible, but it's hard to do. There's a lot more, psychological aspects in terms of getting around the fact that suddenly you have to exercise. Whereas if you're exercising since you were 30, exercise would be nothing to you. And meeting that load and having that capacity to not fall and break your bones would be a lot more easily accomplished if you start now. So let's talk about, let's say if you're injured. When you're injured, the balance between load and capacity is going to be even more important to manage. And really, as the physical therapist, and if you were my client here in clinic, that's going to be the biggest thing. And I work with a lot of clients that not only are injured, but they still want to perform at whatever event or activity that they want to do. Runners, you guys are guilty of this. You guys will run with pain, but then continue to train because every day that you're out is another day that you're losing in training. And I hear it a lot, I see it a lot, where you have a marathon or a half marathon date months out, but if you're hurt, every day that you miss is mileage that you could have done or could have worked on your speed or your running form. And so I always work in terms of making sure not to shut you down, but sometimes, just like in the LeBron James example, it's important to maybe shut down the activity. Maybe not completely, but modify it so that we could allow the tissues to heal. We could allow the load to be decreased so that it's underneath your current capacity. Because if you are performing at near or exceeding your capacity, your risk of injury is just skyrocketing and you're not going to help yourself. And sometimes I've heard stories where they know they're injured, they continue training, so they're either at capacity or exceeding the capacity of their tissues and their muscles. They're constantly in an injured state, in an inflammatory state, and by the time it gets to race day, that's when everything breaks down, because race day, as all you runners know, is much different than training days, even on your fast or hard days. Race day is when your adrenaline is up. Race day is when you want to take that finish line and run even faster. But that high intensity load already exceeding your capacity is just asking for a pretty gnarly injury. And I'm not talking, well, it could possibly be life or death if maybe, let's say, you're poorly trained from a cardiovascular standpoint, but you're thinking either maybe a torn muscle, maybe a torn ligament, or maybe just a really, really severe strain that hurts, and that'll set you up for even more pain and suffering for weeks and maybe months on end. So as a physical therapist, I'm always looking to see what is your current capacity now, what are the loads, the activities that you want to do, and I work with my clients to navigate between those two elements, load and capacity, and figure out what can we modify in terms of our activity so the load is decreased, and then what can we do to always build upon your current capacity. So let's go back to running, for example. If you are hurt, let's say knee pain, very popular in runners, anterior knee pain, so pain at the front of the knee, I'm looking to see what can I do to decrease loads. So that could be either changing the amount of volume in your training or improving your running form so that we can decrease loads while still maintaining the runs that you have to do on your training plan. In addition to that, then I'll be looking to see what can we do to build capacity on top of that. So not only am I addressing load at the same time, I'm addressing capacity at the same time too. And so runners, if you've seen me and heard me talk at the running talks, I'm always saying you have to strength train. And I'm saying that to not only maintain capacity, but build upon it. So then that way, any run at any intensity or speed that you want to do, your body is able to do it. Another example, I think recently could be any office workers. For those that travel a lot, consultants, I know that's very popular here in Atlanta. You're out on Monday, come back Thursday, and you're out on the road, traveling a lot. Capacity may just be, can you survive a work week? Can you handle the long hours and stressful hours of your work? Can your body do that without breaking down? And what can we do in terms of load? I can't, and you know we can't change the amount of work that you have to do. So we know that load is going to stay constant. So what does that mean? We have to find ways to build capacity so you have the capacity to take the heavy work hours, the heavy travel schedule. Because you and I both know load can't change, so you're going to have to look at on the capacity side. What can you do for better rest and recovery so that you can be ready for the next day? What can you do in terms of cardiovascular and muscle strength so that you can handle the luggage lifting and the long walks at the airport so you're not winded? Those are things that you have to look at. And so load and capacity doesn't always have to be sport. It could also mean even just managing the load of your work week for even the daily office worker. So I just want to leave it and finish it there. That for those of you guys listening and watching, be aware of your load over time and maybe even load over an acute basis. Always watch in terms of how you're working with at that load and be hyper aware of how your body is responding to that. So if you're having a heavy work week and at the end of the week your body is exhausted and tired, if we know that you can't change load, then you may need to work on what can you do to build capacity. For the athletes out there, for let's say, again, back to the running example, you know you need to meet these certain mileage requirements for your training plan. If you know that that load is static or you really don't want to change it, then you need to look at it on the other side of the equation and see what you could do to build capacity. If you're injured, then we need to figure out what can we do to decrease load, to allow the tissues, the muscles, the ligaments, and all the body structures to recover properly. And then what can we do to build capacity while not aggravating that injury? So always work on maintaining and building capacity, and always be hypersensitive to the amount of load that your body has to take. Thank you for listening. Thank you for watching. I'm Dr. Ryan Balmes, sports physical therapist here at Endvr Health. Proudly shot and recorded this here at Elite Edge Fitness. Check them out at eliteedgefitness.com. Let me see if I double check and make sure I get that website right. That's eliteedgeatl.com. I'm sorry. Check them out at eliteedgeatl.com here in Chambly, Georgia. And big thanks to them for allowing me to still be here and allow to use their space and to make content for you guys. So again, this is Dr. Ryan Baum, sports physical therapist with Endvr Health. Thank you for watching and listening. I'll catch you guys on the next time. See ya.